People are talking about mobility. What does that even mean? I like to think of mobility as having two definitions because it really does. The mobility most people are talking about is your ability to move around, like I said, and as you age, you move less. As you lose estrogen, you have less motivation to move. And so this is a public health kind of thing that's actually really important. The most common definition of mobility is defined as relative ease and freedom of movement in all its forms. It is central to healthy aging. I don't like to use the word aging because it makes us feel old. I just talk about us like living our best life, okay? And I don't just want you to have mobility, I want you to have optimal mobility, which would be simply defined as being able to go safely and reliably wherever you want. And that involves getting to the floor. Mobility refers to movements of all sorts, such as getting in and out of a chair, up and down from the bed, moving, playing with your kids. And some people have more limited mobility than others. For instance, if you are a type 1 or type 2 diabetic, you are going to have more stiffness because with all the changes that happens with your glucose, it's actually making you stiffer. If you're in perimenopause, menopause, you're actually getting stiffer. So as our hormones change, our mobility changes, and this is why I'm talking about it. I'm perimenopause, my partner's a type 1 diabetic. And half my caseload are people with EDS. They have mobility issues too. Now, as a physical therapist, joint mobility is really important for me because I think of it as the motion within your joints. So I tell my patients we stretch muscles, we mobilize joints. Joint mobility is an important component of evaluation, diagnosis, and plan of care for older adults. Now, I think of that too as your specific joints. Remember, half my caseload are women that have EDS, and these women will have stiff joints and hypermobile joints, and I need to figure out what joint needs what. If you are hypermobile, we need to strengthen it by stiffening up the muscles around it. If you are hypo and you are stiff, we need to do mobility and more stretching, range of motion. And if you come to ask, hypermobility can be defined in many different ways. Hypermobility syndrome is a genetic condition involving extreme flexibility with pain and other symptoms. EDS is a condition that is part of joint hypermobility. Joint hypermobility is a very large amount of people that people just don't know. And these are people that have very flexible joints. But if you have pain and other symptoms, it may be joint hypermobility syndrome. While there's no cure, symptoms can be managed. And the reason there's that is because it's a genetic coding error between your type 1 and type 3 collagen. So you are basically Stretch Armstrong or Elastigirl. And that's just the way you are. And you know who you are because you do weird party tricks with your scapula and your thumb can come to your forearm and your elbows hyperextend and you're double jointed. I define mobility as osteokinematic and arthrokinematic motion. Osteokinematic means you can see the actual joint moving through the range of motions. You see the bones move. Arthrokinematic is what you feel. So joints have to have the ability to roll, spin, slide. And if you don't have that mobility, your range of motion and generalized mobility will be limited. And as a physical therapist, I assess your joint play, which is how much your joints can move. This is why I figure out who has EDS and who doesn't, because I look at the motion, I'm like, that's not normal. Do you know that? Do you know what EDS is? And then begins to talk, and then yes, they have a collagen disorder. And when we talk about joint mobility, there is a resting position and a closed packed position. A resting position is where if my arm is here, everything is loose, everything is optimal, the surrounding tissue is as lax as possible. Closed packed means my joints are the most congruent, meaning if my elbow is all the way extended, that is closed packed, that is a hard and feel. Now, I want your joints to have range all throughout the motion. I want the shoulder joint to be able to go all the way around in a full arc. I don't want any limitation because that limited joint mobility will cause you limited range of motion, which means you'll have limited mobility in your life. And the way I treat patients is I am a manual therapist. I do lots of joint mobility and I fix rib dysfunctions and bendies all day long. And if you don't know what a bendy is, it's just a hypermobile person. But when I am doing joint mobs, I'm grading how hard I am pushing into that joint. And the joint mobilizations, an example would be this. And when I mobilize joints, I get all these mechanoreceptors going and it feels good. And it sometimes can allow the muscles surrounding the joint to relax. And then sometimes we might get a cavitation or a pop, and that's okay. I don't have to have a pop to make my joint mobility be better, but if it does, fine. So joint mobility can mean general range of motion, your ability to go up, down, get to the floor, or it can mean specific arthrokinematics of each individual joint. If you have an arthritic joint, odds are good it is stiff and it is limited. But research shows you don't have to live like that. We can bend and mend. What you do mobility wise and how you move through your range can make a difference. My patients are all doing stabilization for whatever is weak. They're doing mobility for what is stiff. And then they are walking and lifting. And we will add in specialized corrective exercises if that's what you need. But everybody needs to spend 10 minutes of mobility a day. Even you, bendies, even you, because your thoracic spine is stiff and your talocrural joint and your ankle also stiff. And it's okay to mobilize bendy people if you are working on the joint that is hypomobile and limited, because those stiff joints affect the total movement pattern and their overall mobility. Yeah. So remember, you stretch muscles, you mobilize joints. Together, that whole mobility is your ability to move through life. Watch a child move. I want to have the ability to squat gracefully to the ground and get back up like a toddler because they practice it all day long. When was the last time you practiced getting to the ground?